Hi, my name is Dr. House here at Foundation Health and Wellness. We're going to be talking about what an adjustment is today. We're going to be looking at why it's there. So just a little bit brief intro. What we're looking for is called a subluxation. That's a big fancy term. Basically what it's describing is to identify an area that doesn't move correctly, that's also causing a problem with potentially nerve or soft tissue around it. And so basically what we're looking at is restoring mobility. There's a few causes for that. Usually it's repetitive motion, sitting for long periods of time, or accidents or injuries. Essentially what happens is we've got an area that doesn't move correctly, and it causes the spine to settle, start to break down, and then you start to move around on it, and it creates wear and tear to other places of your spine. So to identify one, we're looking for 5 things. One is abnormality in posture. We're looking for swelling, any kind of muscular control problems. We're looking for heat issues, and then we're looking for any kind of joint mobility issue. So what we're going to be doing is looking at leg length. We're going to be looking at hip level, and we're going to be looking at range of motion within the joint itself. Okay, I'm feeling for taut and asking for any kind of feedback on tenderness, any kind of swelling or pressure in a particular area or joint. And then if someone has that in that particular area, then we're certainly understanding that that area is needing to be adjusted. And so there's no popping or cracking any bones. That's called fracturing your spine. So what we're doing is getting the joint to move. And usually there's an audible sound with that, but that's usually because the joint's real sticky. We've got to get through that. So when we perform an adjustment, what we're looking at with the positioning, I put someone in a certain position to isolate usually one joint at a time. And so you'll see her lay on her side, or lay on her stomach, lay on the back, and then I'll be using different techniques to feel for that end joint play or restriction to see where the adjustment specifically needs to happen. It's a game of precision, and so it's not just lay them down and willy-nilly. It's a very specific place that usually needs an adjustment in. So you just witnessed what an adjustment might look like in someone. So there's many different ways to take care of someone, and many different goals that people come in with. So if you're experiencing an adverse symptom that you don't like, even if it's numbness, tingling, a headache, migraine, some sort of symptom that's interfering with your daily life, if you're wanting to be proactive with your health and understand problems before they become a problem or a bigger problem, or if you want to gain a competitive edge, then give us a call. We'll be glad to look at you and let you know if we can help or not.